So I do like to look at how people move globally because I am definitely not somebody who is, let's just say, a purist. I like to use various systems. So I also have done some teaching with SFMA and FMS where they're looking at more global movements. And so I combine that with looking at how people move in various different directions. And then I look at how the joint mobility at the different joints. So, is there something that is restricted? Once I kind of hone in on the main areas and figuring out, is it truly a mobility issue or is it a stability issue? Because if it's a stability issue, I'm going to go down a different road. So I like kind of determining, okay, if it's mobility, then I'm going to mobility test the areas that I anticipate to be restricted. Part of my assessment is looking at the firing patterns and the movement patterns of different muscles. So say, for example, glute max, just looking at the overall firing, not just is the glute max firing, but looking at the overall pattern. And then if that is a dysfunctional pattern, then looking at what could inhibit the glute. Is it a hyperactive hip flexor or tight anterior capsule? Is it L5S1? Sometimes it could be something in the viscera that can be restricted. So I want to figure out why that's inhibited and what's inhibiting it. And that's where I love the exercise course in complement with muscle energy, because it allows us to look at movement patterns and quickly go, okay, how can I get the biggest, quickest outcome, which is by treating those areas that are going to influence that inhibition or that tone. And then I love to use the newbie right after because it then just reintegrates that movement pattern.